For this special occasion, we have with us a very special person, Dr. Pawan Kumar Singh. Dr. Pawan Kumar Singh is a well-renowned thoracic oncologist, and he has been into a lot of research work regarding lung cancer, and he has a lot many publications and chapters to his name in reputed journals and books. He is also a member of the editorial board of Journal of Thoracic Oncology, which is the journal for any type of thoracic cancers. He is also the member of TNM Staging 10 forming committee as well. So welcome, Dr. Pawan. It's our fortune to have you here with us on this special day. Just for the public, what do you say about lung cancer? Is it really a big concern compared to other cancers, or how do you feel?
First of all, thank you so much, sir, for inviting me here. Now, as you discussed, lung cancer is a very rapidly growing problem in India, especially. Lung cancer right now is the second most common cancer after breast cancer, which is diagnosed. If you ignore the individual aspects of other cancers like oral cancers, in every 5 minutes, one new patient of lung cancer is being diagnosed in India, and in every 7 minutes, one patient is dying because of lung cancer in India. If you look at the deaths caused by all cancers, the contribution of lung cancer is highest among all of them. And the reasons for this high incidence in India is probably smoking, air pollution, and poor lifestyle habits and other risk factors like using of alcohol, lack of physical activity, and all those kind of things. In India, especially, lung cancer is diagnosed at least 10 years early compared to Western countries. The accessibility to cutting-edge treatment in India is very limited to general population, and most of the people are unable to diagnose cancer at either early stage or are able to get proper diagnostic services or proper treatment services.
So, the data given by Dr. Pawan tells us that lung cancer is a very serious problem which we are facing as of today, at least in India. And again, lung cancer being diagnosed at an younger age compared to Western countries is also a big concern. Dr. Pawan, now that we all know that as clinicians in my practice, I find we routinely diagnose lung cancers at a very advanced stage. It's hardly very few patients we diagnose at a very early stage, wherein we can offer them curative treatment. So, what is your take on lung cancer screening? Who should get it done? How much of use it is? And is there any harmful effect of screening for lung cancer?
So, only way to diagnose cancer at lung cancer at an early stage is lung cancer screening. You do that by using a low dose CT scan, which is done every year. And if you diagnosed any new lesions that are suspicious, you follow them up very closely. So, after the age of 50 years, all patients who have been smokers or who have a family history of lung cancer should undergo LDCT yearly and should seek the opinion of their pulmonologist so that they are aware about how to deal with those CT scans and how to deal with those findings that are coming up in CT scans. This is the only way to reduce mortality.
Is there any significant harm in getting CT scan done every year?
So there is no concrete evidence to suggest that radiation exposure because of LDCT will contribute to any harm, because the radiation exposure because of LDCT is very low in intensity and it is just a screening CT scan. So if you are able to find a nodule, thereafter the actual workup and actual CT exposures come up. So for a screening tool, LDCT offers a very minimal risk considered other things.
When it comes to cancer, and especially the lung cancer, people think that once a patient is labeled as a patient of lung cancer, that it's like not treatable or not curable. Is it true or is it a myth?
Lung cancer has the problem of multiple other comorbidities, like patients have presented late stage. Most of them we are not able to cure them. But despite everything, lung cancer is still a treatable and potentially curable if diagnosed early. So it is definitely a myth that patients of lung cancer should not offer treatment. We have evidence, we have our own research publication in which patients who are stage 4 and who are not in good general condition, they come to us and we are able to offer them something that might improve their lives, improve their longevity, even improve their performance status in general condition. So every lung cancer patient should seek an opinion from a pulmonologist or an oncologist so that they are aware about the treatment options irrespective of the stage or the general condition of the patient.
Confirms the fact that once you are diagnosed lung cancer, it's not a doomsday overall, and definitely you can get treated in expert hands. So now coming to the treatment part. So whenever we think of cancer, everybody thinks of surgery and chemotherapy. So are they the only options, or you have any advancement in treatment protocols where you can, like we have been discussing a lot about the targeted therapies, the immunotherapies. So anything you want to tell the public about this and the cost involved in that, and is there any program or support programs which can help patients get access to these kind of high end or recent advancement treatments?
So, the treatment of late stage lung cancer has become very complex in the recent times because there are so many other therapies that will offer the patient better treatment, better response without compromising on the side effects or the safety, overall safety of the patient. So, if the patient comes to our clinic, at least 20% to 25% of them are eligible for a targeted therapy. That means one single tablet that will be taken where the patient will be able to control the symptoms, control the stage, and improve the overall survival of the patient. So at least 20 to 25 patients will get benefited from proper testing and proper treatment of those patients. In the remaining patients, ideally, immune checkpoint inhibitors or immune therapy will offer a lot of advantage. Adding chemotherapy, depending on the performance status of the patient, is another way to go forward. Finally, if you have localized lung cancers and the patient is not able to undergo surgery, localized radiation can kill the cancer entirely, thereby offering a long-term cure. Yeah, these all treatments are apart from the conventional treatment of surgery and chemotherapy. So definitely there are n number of options, and there are several support programs run by the pharmaceutical industry, even the cancer societies of India, even the specific hospitals, that they are able to provide you some financial assistance or other kind of patient access programs or supports which will improve the access to these therapies, even though some of them are very costly. But later on, it is likely that because of reduction in subsidies, number of patients who are going to get benefit on this therapy is increasing.
Thanks on that. So the take home message will be, please prevent lung cancer. How do you do that? Stop smoking, try to reduce the pollution levels, and if there are risk factors, please get screened, and if there are especially symptoms, please get tested and get the cancer diagnosed early. And as Dr. Pawan was telling us, even if it is diagnosed, even in later stages, nowadays the treatment is so advanced that without chemotherapies, with targeted therapies and immunotherapies, we will be able to make the patient's life better and also increase the longevity as well, without being bedridden or without having much of side effects of the treatment. Thank you, Dr. Pawan. It was excellent to have you here, and you have answered most of our queries in a precise and crisp manner, and I think this will clear the doubts in the mind of the viewers and also raise some awareness regarding lung cancer. Thank you very much.
Thank you, sir. It was a pleasure to be here.